What's good, everybody? Gerald Moore Jr. checking in, tapping in. Blessings and greetings to everybody. Just want to do a quick video, man. This is actually an early morning. Had a nice nap. So I'm up doing some work, and I just came across this video on Instagram talking about a prompt to put into Chat GPT. And so, video. So I wanted to share the chat or the prompt that I just put in. And so here's the prompt. I want you to do some research for me. Act as an expert in Instagram social media marketer. Tell me 10 frustrations, 10 desires, 10 fears that Black men experience with their health and wellness. Put it in a table format, label X axis 1 through 10 and Y axis frustrations, desires, and fears. And so here's ChatGPT. Sure, I'll compile a list of frustrations, desires, and fears that Black men may experience concerning their health and wellness. Here's the table format you requested. So here you have it, 1 through 10, frustrations, desires, and fears. And so I want to go over these because I wanted to share this. Um, sorry I wanted to share this with you guys because I think it's important, uh, especially as Black men, as we, continue to gain autonomy over our bodies and, in this world that we're living in. And I think it's important being a healthcare professional, knowing the data, especially being a millennial, a husband, a father, somebody that's in the spaces where there's not many of us in the healthcare space. Um, and so I wanted to share this really quick. I'm not going to go over all of them in terms of going in depth, but I just wanted to share this information and, continue the dialogue as we continue to be on this journey together. So please like, comment, and subscribe to the page. If you like this type of content, if you want more of this type of content, please comment and subscribe and let me know. So here is, you can also follow me on Instagram at Gerald Moore Jr. On my personal account. So here are the frustrations 1 through 10. Lack of access to quality healthcare, healthcare disparities based on race, feeling misunderstood or overlooked by doctors, limited resources for mental health support, cultural stigma surrounding mental health, lack of representation in healthcare media, higher risk of certain health conditions, barriers to accessing fitness facilities, limited knowledge about preventative care, inadequate health education in schools. The desires, achieving and maintaining optimal health, having a strong support system, having access to nutritious food, living a long and fulfilling life, feeling physically fit and strong, being able to afford preventative care, having access to safe exercise spaces, achieving work-life balance, feeling confident in their body, maintaining mental and emotional well-being, fears, developing chronic illnesses, being unable to afford medical treatment, being misdiagnosed or receiving inadequate treatment, losing mobility or independence due to health issues, passing health issues onto family members, facing discrimination in healthcare settings, experiencing complications from untreated conditions, being unable to participate in important life events due to health issues, being unable to afford medications, and being a burden on loved ones due to health problems. These frustrations, desires, fears highlight some of the challenges and aspirations that Black men may face in their journey towards better health and wellness. And I mean, that sums it up. As a Black man, it's obviously the data and the research is coming out, but we know this since birth, since childhood. Our mothers have been misdiagnosed, mistreated. Our fathers, our grandparents, our great grandparents. So this is nothing new, but obviously having stuff in context like this is important, and I think having the conversation is important. One thing that I will say is that community is a very important, and understanding health. Like if your parents' health isn't well, then that's going to trickle down to you. It's going to trickle down your stress levels, your anxiety, the amount of money you have. If your parents don't have money, you might have to pay a lot more out of pocket expenses if your parents don't have good health care. and they weren't able to get you good healthcare treatment when you were a child and young adult, that's going to have an impact on your life. And that's going to trickle down to your kids. So, lack of quality healthcare. How far do you have to go to get to your doctor, to get to a dentist, to get to a nurse, to get to, a surgery or any type of, preventative care, a gym? Do you have quality gyms around you? Do you have quality trainers? Do you have nutritious foods? When you look at Black men in the communities that we live in, typically we live in food deserts. So places that don't have, enough fresh produce. You look at alcoholism, you look at mental health issues. So dealing with racism is a mental health thing. Um, could also prevent you from working or working at your peak performance, which can impact your money, impact your relationships. So there's just so many things, that as Black men we're navigating and dealing with. And unfortunately, it's not easy to deal with it in real time. And right now we're dealing with it in real time. We're dealing with mental health illness in real time. We're dealing with the rise in suicide rates in real time. We're dealing with COVID-19, and we're dealing with high blood pressure in real time, while trying to while trying to build and develop systems that are in place for other communities, but not for us. Or just feeling the lack of authenticity when you go into a healthcare space. Healthcare space is not having enough, minorities or African American males. When you go to a doctor's office, if it's all women or all white men and white women, you don't see yourself. And so, how could they know what you're dealing with? The type of, real life situations that we deal with, in our personal lives, just because we're melanated folks. You know what I mean? Like the reality is we come from, communities that have been neglected and underserved for decades, for centuries. And that's impacted our health, and it impacts our health every single day. So I think conversations are important, but I'm still getting familiar with ChatGPT, but it's a great resource to do what I just did. Put store stuff into format, and then I'm going to actually take this and I'm gonna do maybe I'll do one of these every day on my social media, because I do want to do more content in terms of um, education, resources, and being a platform and being a space for Black men, to learn and grow and build. Because we need more mentors, we need more Black educators, we need more Black healthcare professionals. I am a healthcare professional. I do have my bachelor's in healthcare administration from Ohio University. So I've studied healthcare in terms of going to undergrad. I haven't done any in terms of extended education in terms of going to get my master's and my PhD. Thought about it, but just been living, right? Having real life experience. Sorry about that. But yeah, check this out. Make sure y'all subscribe, like, comment on this if you're a Black man and you have health issues, or you have concerns, you have frustrations, desires. Let me know. What are some of the frustrations? What are some of your desires? What are some of your fears that you have for healthcare? And what are some of your solutions? What are some tangible solutions that we can adopt or bring into the immediacy of these issues. So let me know in the comments. Be sure to follow me on Instagram at Gerald Moore Jr. You can follow me on X, Twitter as well, Gerald Moore Jr. as well. So thank y'all for tuning in. Peace, love, blessings, and health to you all. Peace.